Blackburn.
Enterprises.
All right, now we're about to get a little personal.
Yes.
Okay, we definitely want to talk more about when you learned that you had cancer. How did that happen for you?
I was diagnosed in April of 2019.
Okay.
I had been having stomach pain, and I was feeling really tired and lazy, and my appetite was kind of all over the place. But it had been going on for probably about a year before I even went to the doctor.
Okay.
I just do what we typically do. I'll be all right.
Right.
It's my diet. It's this. It's that.
Right.
And I finally went to my regular physician. And even then, it took me months to get her to do ultrasounds. And we had to do 2 before we finally saw something on the ultrasound, and she referred me to the OBGYN who sent me to oncology.
Got you. Okay, so you finally did all that, and then what did they discover?
They found 2 cysts on my ovaries. I had 1 on each ovary. So we did blood work, and there's something in your blood called CA-125.
Okay.
And that is a marker for women for ovarian cancer, and my blood count was super, super high.
Okay.
So that's why she sent me to oncology, and we still had to do CT scans and more blood work, and finally we scheduled the initial surgery, which was just an exploratory surgery.
Right.
Discovered that it had already spread to other organs, and
right.
That's how we got the official diagnosis and knew like what stage it was and
right.
the type of ovarian cancer I had.
Okay, so what type of treatment did you have to go through?
So I did a total of 6 rounds of chemo. I did 3 rounds of chemo. Then we had what's called the debulking surgery, which is when they go in and remove all the tumors. And then I did 3 more rounds of chemo. And then I started the oral chemo, which is a pill that I take every day. And I'll be on that for the rest of my life.
Okay, so it looks like after going through this, that you've pretty much been able to spread your message and talk more about it, make sure that people are more aware and have awareness about that. How has that been going for you?
For me, it's been very therapeutic. I didn't want to keep everything bottled in because I felt like I would just get more depressed. And I'm I don't want to say obsessive, but I tend to obsess over certain things. So I felt like me, using my social media and spreading awareness and talking about it gets it all out. So I'm not constantly thinking about it or worried about it. I just get it out there and I let it go. Plus, the support from everybody has been absolutely amazing, and that definitely keeps me going.
Definitely. Actually, we were one of those people to support you.
You were, absolutely.
Yes. Shout out to the pajama party.
Yes.
Yes, but thanks to that, we were able to give you a donation. So you've been able to, through your journey, being able to talk about it, you actually were able to receive or be recognized as our overcomer, I believe. Is that correct?
There is an organization called Overcomer out of Houston, Texas.
Okay, shout out to H-Town.
Yes. Her name is Ansel Renzi, and she started the Overcome organization after her mom lost her battle with ovarian cancer. And basically, she picks women from all over the world who are going through treatment.
All over the world.
And they give donations to them. They send gas cards, grocery money for bills, things like that. And I was recognized as one of their overcomers.
All right.
Survivorship banquet.
Right.
And we have
congratulations, by the way.
Thank you. We have people from Africa, New Zealand, like literally all over the world tuned in to that banquet. So that was really cool.
Oh, well, that is nice. So I think what happens a lot of time is people don't, just like you said earlier, when you were going through, I guess, I don't even know if symptoms is the right word to use, but when you were going through things, you kind of just didn't pay it attention. So
I didn't.
So what are some things that you would think people should look for?
Definitely, I had a lot of bloating, and most women just write that off as cramps and that time of the month. But if you have bloating, lower back pain, changes in your appetites, changes with your bladder, if you find you're tired all the time, get to your doctor as soon as possible, because those are all symptoms of ovarian cancer, and that is not something that your OBGYN checks for at all. So if you have those symptoms, do not ignore them.
Okay,
Get tested, push, and ask those questions.
Okay, so you said your OBGYN doesn't check for that. So who would check for that?
So you have to like ask. So women are supposed to go to the OBGYN regularly for checkups. A
Mm-hmm.
normal checkup doesn't check for it. You have to have an ultrasound and blood work, which is
Okay.
not something they typically do. So if you have those symptoms, you can talk to your regular physician or your OBGYN, but push them, ask those questions, tell the symptoms, and let them know what's going on so you can get the additional testing done that needs to be done.
Got you. Got you. Okay, so do you have any advice for those that may have just recently found out, that they were diagnosed with cancer? Or
Yes. I will tell you what my doctor told me is your attitude determines how well you're going to make it through the process. She told me
okay,
from the very beginning, if you have a positive attitude, you will beat this. If you let it get the best of you and you get down and you get depressed, it's going to make it that much more difficult. And I definitely think that made a huge difference. I made up my mind from the beginning that we were going to beat this. So I kept going to work. I went by my day-to-day routine like I normally would.
mm-hmm.
And every time I felt myself getting sad or depressed, I would call one of my friends and go over there and laugh and drink wine and have a good time.
Hey man, wine makes everything better.
It makes everything better.
All right, we gotta love that positivity.
Yes.
All right, so you want to give any shout outs?
I do. I'll shout out my best friend Z because she came to all my chemo treatments with me.
Shout out
her
best
and
friend.
her husband Taylor. So shout out to y'all.
You're my best
And
friend.
to all my supporters and friends, family, you guys have been there for me for the beginning. So I thank you all.
Okay. All right. You want to give them your social media?
Yes. On Facebook, it's Amanda Jeniece Wallace, my full name. On Instagram, it's _Jeniece_, and that's JENIECE.
All right. So no lasting shout outs. Anybody might have forgot? Maybe.
Um, I'll remember it later, so when I share the interview, I will tag you in it. Y'all know my mind ain't all that good. No, for so.
As my granny would say, my mind ain't long.
Yeah, charge it to my mind, not my heart.
Right, exactly. All right. We definitely appreciate that. I'll holler at you. Peace.